Welcome everyone to our February guest speaker event with physician assistant Casson Anton. We'll get started in a few moments, so feel free to say hi in the comments.
Welcome Alliance hosts and members to our February guest speaker with P.A. Anton. Good evening, I'm Yati, and I'm one of your sophomore council members, and I'm so excited to be here tonight.
Hi guys, I'm Anushka and I'm one of your guest speaker committee chairs, and I'm so excited to be here with you guys for you guys to meet Miss Anton. And just as a reminder, we're going to have a QR code for attendance at the end, so make sure you stay the entire time.
Before we begin, I would like to introduce our CTSO to any new members. HOSA is a student-led healthcare organization that strives to prepare students to be the future of healthcare. Through Alliance Academy's HOSA chapter, we bring you monthly guest speakers with a wide range of specialties from all around the globe.
Now, with further ado, tonight's guest speaker is Miss Anton. And on behalf of Alliance HOSA, we welcome you with warm and wide arms. Thank you so much for joining us. We are truly honored. We are going to start off with a discussion, and we'll have the opportunity for members to ask questions towards the end of the event. So that means the floor is open to any questions at the time, so make sure you type them in the chat box and we'll get them answered. Miss Anton, why don't you begin by introducing yourself and tell our members a little bit about your field?
Sure. Thank you guys so much for having me. So I am a physician assistant. As you move forward, there may be some confusion because we're in the middle of a name change actually to better reflect what we actually do to physician associates. So if you see that out there, it's actually the same thing. But PAs is what we all go by. It makes it much easier. So what we are licensed medical professionals. We can diagnose, we can treat, and we can prescribe medications. We have a very similar education to medical doctors. I would say the big difference is that what's very unique to the PA profession is that we work in conjunction with others. So we always work on a team as opposed to working as solo providers in a practice, as some other providers can do. Just a little bit about me and background. I think there is a feeling in the healthcare field that there is one track. There is only one way that you can do this. I was actually, my undergraduate degree, I went to Tufts University in Massachusetts. I was not a science major. I was a soft science. I was a psychology major. I did get a bachelor's in science, but I just say that so that to understand if something doesn't, that's not your path. There's a lot of different ways that you can make healthcare really work for you. One thing that's unique to PAs, and that would be unique to me, is PAs, you have a career before you actually become a PA. So my background was in nutrition and specifically holistic nutrition. So I worked with people with weight loss. I looked at how food harms or heals the body. And so I did that for almost 10 years before I actually applied to PA school. It's very common for PAs to work as dietitians, work in EMS as paramedics, athletic trainers, ultrasonographers, all sorts of things. As long as you work with patients, you have the opportunity to actually be a PA. I'm actually also originally from California, but I came to school for PA school at Emory University, and I stayed. I have a couple dogs and spend a lot of time with them. And since I've been a PA, I've worked in primary care, and I currently work in family medicine actually here in Cumming. So hopefully that gives you a little bit of a sense. I know there's a lot of other questions. I'm happy to answer anything else.
Yeah, so how did you pick that you wanted to be a PA? Like, was there something that happened that you wanted to do it, or was it just something you wanted to do?
A great question. So to be completely honest, I never thought I was going to work in medicine. That was not, I know I'm so impressed because some of you, you know, that's what you want to do. I wasn't sure what I wanted to do. I studied psychology because I found it very, very interesting and very interested in how people think, how people work, and the dynamics of people. And I had some other careers to begin with. I worked in nonprofit, and then I found that I absolutely loved nutrition. I found it very fascinating. And so I did that. And I actually had my own business in nutrition for a number of years. But then I found I was missing this piece of knowledge to truly be able to treat the whole person. I can help in so many ways, in preventative ways, in lifestyle ways, but I wanted to be able to do more. So I wanted to be able to look at labs, to be able to understand that. And so it actually had been suggested to me probably about 10 years earlier to go to PA school. And I was like, nah, I don't want to go back to school. But it came to the point where I made the decision that, yes, I actually really do want to be a PA. And so for me, because it'd been a little while since I'd been in college and I'd been more the soft sciences, I actually had to go back and take a couple years of prerequisites to do some of my studies, and then went to another almost 3 years of PA school. So I say that to give people hope that if you're like, I think I want to do this, but I'm not 100% sure, you have time, and you can figure it out little by little.
Yeah, medicine's a big field, so like you need time to decide which specialty and what exactly is your passion.
I agree. And make sure that you want to do it because it takes a lot of dedication and work.
Yeah. And our member has a question. So, why are you called a physician assistant if you have a very similar job to a normal physician?
That is a great question. So our history is actually very interesting. I'm going to take us back a little bit. So our profession started in the 1960s because there was a shortage of physicians, primary care physicians in general. We had kind of a war going on, ending, and we had all these people in the military who had this amazing, all of these skills to be able to act like medical professionals, but they didn't have the degrees. And our original name was actually a physician associate. So our whole practice and our field within healthcare has been started that we always work as a team. And you can see us as almost we are extenders in the sense that we will always work with a supervising physician. So our scope of practice is whatever our supervising physician can do. And we work, we have a little bit of different training. Obviously, it's a shorter time period, but we have the same medical training in the sense that our education follows a medical base instead of versus nursing. It's a nursing education. So we are trained very similarly to physicians, but we don't specialize. So our training is as generalists, and really the original goal was to get us into primary care, to help in rural settings, to help in lower income, underprivileged areas that really needed us. So I think they gave us the original name of going with the physicians because we are meant to always work as a team with a physician, and almost more, I would say almost physician extender would be a good one, but we are not physicians. So we do not get doctorates. We get, at this point, we get masters. So we're not doctors. We are PAs. And I think that with the name change also to a physician associate, I think allows people to maybe think of us more as we are our own individuals. Like I have my own patients. I work independently within the clinic, but my license, it's confusing, but my license is always with a physician. And so we are not assistants. I'm not sitting there with my physician in the room as an assistant, but I'm more an associate and I'm a colleague. So hopefully that helps. It's a little confusing what they've done. And I will admit the public, a lot of times patients, they don't understand our role, which is interesting, even though we've been around for 50 plus years.
Yeah. That's like really interesting with your job and the transition it's had with its name.
It is.
Are there any other misconceptions about your job that people have had?
Yes. So interestingly, people will think that we are doctors in training. So people will ask, when are you going to be finishing, or when are you going back to medical school? When are you going to be a doctor? Our training is different. We are not expected to have all the information and training that a medical doctor does. We are there again as extended, but we have a lot of that information, and a lot of PAs who've been working for 10, 15, 20 years honestly have those skills. So I think that's a big misconception. Or they think that we, are just the assistants. Like we're similar to, we're just there to help out, that they don't realize that we are medical professionals who, again, going back to what I said, we prescribe, we diagnose, we treat, and all that. So I think those are the biggest misconceptions. And again, as I said before, even though we've been around, I think we're at about 53 years now. The language around what we do, people don't understand. PAs in different countries are very, very, very different. So there can be some, doctors do a similar job throughout the world, but PAs don't. I'll give you an example. In the UK, PAs are much more like medical assistants as opposed to providers. So there can be some confusions and misconceptions there as well. But PAs are phenomenal. They do a great job.
Yeah, I completely agree. So I'm pretty sure you've seen many patients. So what's one of the coolest things about your job and one of the coolest patients or patient encounters?
Ooh, yes, I have seen a lot. I think the really nice thing, my working in family medicine, I always wanted to work in an outpatient clinic because I want that continuity with patients. And I think it's the relationships. It's seeing the people come back. We will see people over many generations. We see the grandparents, we see the parents, we see the kids, and we see the grandkids. And so I think knowing the families, as primary care, what I think is really neat, and I didn't realize so much going into it, is how much people rely on you. They trust you because you have built that relationship by being compassionate, by listening, that they'll be told something by their specialist and they want your opinion, even though that's not your specialty, because they say, hey, you know me. Kind of the coolest thing we've seen, it really depends on your definition of cool. I will say I have seen, this is maybe not cool for the patient, but it's, for me was really neat. I had a patient coming in for something that we call, a medical term, onychomycosis, which is a fancy word for fungal infection of the nail. He was coming in, he had a thickened nail. He wanted to finally get rid of that, talk about medication. And with every patient, it's very important to listen to heart and lungs. And then when I went to go listen to his lungs, I heard some wheezing. And I was like, what's going on? Have you been sick? And he's like, no, I feel fine. And I was like, well, I hear something. Do you have asthma? No history of that. So we actually gave him some albuterol in the office, because sometimes with wheezing, it tells us that there's inflammation in the lungs and there's a narrowing. It's kind of like if you were trying to breathe through a straw that was being pinched. And so sometimes it can make a little bit of a whistling noise. And so we gave him a treatment that should help really open up that space, decrease the inflammation, and there was no change. I'm lucky to be able to work in an office where we have an x-ray machine there. So I said, hey, do you mind if we take a chest x-ray? And I love it. He was so nonchalant. He was like, yeah, whatever you want to do, that's fine. Poke and prod me. Well, I went in there and I found a tooth in his lungs. And I was like, what is this doing? And so I went back out and I said, sir, you have a tooth in your lungs. And he was so not phased. And he went, okay. I said, have you lost a tooth recently? And he was like, well, yeah, I had a procedure done. While he was being intubated, they accidentally hit a tooth. It went down into his lungs. He didn't care at all that his tooth was gone. And so what we had to do with that, so teeth, there's a lot of bacteria with teeth. And so we had to start him on an antibiotic, and we had to get him over to a pulmonologist where they actually did a procedure where they had to go down into his lungs, grab that tooth, and bring it out. So it was very interesting. You come in for toe stuff, and we found something in your lungs. So I thought that was pretty interesting, cool, because it was certainly not what we were expecting that day.
That's really, really cool.
Yeah.
Not what you expect at all.
Not in the least.
So what cases do you see on a regular basis?
The most common that we end up seeing in family medicine is dealing with upper respiratory infections. Right now, it's certainly cold season, flu, just any old virus, bacterial infections, and then hypertension, which is high blood pressure. And then we deal a lot with diabetes. Those are kind of your bread and butter, I would say, of primary care. But again, I work in a very unique setting where with my supervising physician, he's an ex-ER doctor, so that allows me to be able to do a lot. So I took glass out of a gentleman's finger the other day. We did an incision and drainage of a abscess as well that day. But our bread and butter is really kind of blood pressure, diabetes, and then upper respiratory infections.
So since your field's pretty vast and since you're doing many things in your field, what's like something else that you considered becoming other than a PA?
Oh, that is a great, great question. I will admit I had no plan B after going to PA school. I put everything I had to go into PA school. But I will say, if I had a dream where I could do anything, I would open up a dog rescue. That's what I love animals, but I will admit I did not. Again, I didn't have a plan B, so I'm not sure. I probably would have just continued in nutrition.
Got it.
So do you have a lot of challenges on a day-to-day basis? Are there things you have to work through, or is it pretty simple?
Yeah, I will say in general, even working in healthcare, you're working with people, you're working with a lot of different personalities, you're working with anxiety, you're working with fear sometimes about what's going on. So I will certainly say, for me, my goal is every time I walk in a room, I am 100% present for that patient. So that takes a good amount of emotional energy to be there, whether somebody's crying because they just lost a loved one, whether I'm having to tell them that we found cancer, or whether they just have an anxiety over anything. And then, in healthcare, it's changed a bit. And so you do see higher amounts of patients. I would say I see anywhere from 20 to 28 patients a day, which is a lot. So I would say it's challenging energy wise. It can be, and sometimes you get the hard cases where I find that it's very helpful to be honest of saying, I'm not sure what's going on, but we're gonna just have to keep playing it as a detective and keep trying things. And so it can be hard sometimes. Somebody wants an answer, I don't have it. I don't always know the answer, and we don't always have it.
Yeah, that's true. There's not everything that you're not knowledgeable about every single thing. So there's some things that you have to be like, I don't know, or I'm not sure. So I'll get back to you on that later.
Absolutely. And I think it's actually very important in healthcare and in anything you do to be able to acknowledge your limits, that if you don't know, you say you don't know, but then you put the effort into doing it. And then you get somebody to where they need to be. I think it can be very dangerous if you just kind of start throwing things at people and act like you know everything. There's not a single person in this world who knows everything. So there's always, other people to talk to. That's why we work on teams. You can get information from others. That we have a lot of resources online that we tend to work or use in healthcare as well.
Yeah, so I know that we have talked a lot about you being a PA, so I want to kind of shift towards you being an entrepreneur as well. So can you tell us a little bit about your business?
Absolutely. So I started a business with one of my best friends from PA school, and it's called This Way to PA. And a couple different things. As PAs, we tend to do a lot of volunteer work, and it just seems to be natural in the field where we tend to give back. Both of us, since for a long time since we've become PAs, we've been mentoring different people who want to get into the career. And we decided as a way to give back is that we would start a business where we actually help people from inception. So from having this dream of wanting to be a PA to helping people with applications. There's personal statements that have to be done, to there's interviews to get into school. Then when people are actual students, helping them with different challenges. PA school is, you may have heard it, it's like drinking through a fire hose, which is pretty tough. So, helping with the balancing of the stresses, with studying techniques. And then we continue with, once people graduate, of helping with resumes, with finding a job. And then what we do also is we do blogs. So trying to really bring education to people to understand what is it actually like to be a PA. So for instance, last week, it's going to be on there soon, but I interviewed a PA who works in orthopedic trauma surgery. Very interesting. And he's also a PA in the military. So very interesting. And I personally hadn't heard any of these stories. So we're trying to bring that into the field so that there's just more information out there. I will say, being an entrepreneur as a PA, most people don't think of you being able to do that. We think of mostly doctors being able to own their own businesses or doing things like that. But as a PA, there's a lot of opportunities. You just have to be creative. And for us, we're super excited to do this and being able to use just a different part of our brains and think differently than just in clinic.
That's really cool how you started a business and you're not just focusing on one thing. I think that's really cool. So was starting a business an easy decision, or did you have to think plan it out and think decide and give a lot of thought into what you wanted to do with that?
Yes, good question. Starting the business was easy. The idea of it, of starting it, all the pieces to it, that's taken some good time. Absolutely. And we're always coming up with new ideas, but I will say the idea, so since graduating from PA school, I have tutored PA students. Mostly I end up tutoring Emory PA students. I'm a preceptor to both PA students at Mercer University as well as Emory University, as well as nurse practitioners at Emory University. Again, we've done different mentoring through what our national organization, which is called AAPA, the American Academy of Physician Associates. And so it just made sense to do this because we were doing it already. Both of us were. So deciding to do the business was the easy part.
So regarding your business, one of our members has a question.
Yes.
So typically, medical professions are very busy. So does your job schedule allow you to have more time for your business?
I would say yes and no. I make the time. Since I've been out of PA school, so as a PA, I took out loans. And since I've been out of PA school, I've worked two jobs the entire time to pay back my student loans. So it's I've gotten used to it. I do at my job, I do work 4 days a week. And so I work about 10 to 10 and a half hour days, 4 days a week. So I do have a day off, which absolutely allows me a little bit more breathing room to be able to start the business. But I do a lot of work, after work, for instance, talking with you guys, this would be something after work. On Monday, we talked to a pre-PA fraternity in Michigan. So I will say yes and no. I think we all decide where we want to put our energy. And if something is fun for you and you enjoy it, you'll make the time for it.
That's really cool how you make the time for what you want. I think that's really nice because it's important to prioritize yourself. So what does a day in the life look like for someone who's managing two different things?
Sure. So my day usually is I get to the office by about 7:15 in the morning. We start seeing patients at 7:45. and we usually see them till 5 o'clock. I don't know what's coming in that day. I do anything from annuals to, again, I've had somebody walk in the middle of a heart attack before. So you just never know. So we see patients. Our regular kind of weekly appointments are 15 minutes is what we're allotted. Our annual, when we do a annual visit, that's usually a 30-minute appointment. So I do that. I usually leave anywhere, once I'm done, anywhere from 5:30 to 6. During my day, I have to write a note on every single patient. That note will entail what the patient told me, what their chief complaint is, how long it's going on for, what they've tried. It'll include a physical exam that we do on every single patient. And then I'll have my diagnosis in there, and then what I want to do is a treatment. So I do that for every single patient. And then I also end up doing the billing for that patient as well. So I do that for however many, anywhere from 20 to 28 patients a day. And then I also, during that time, patients are going to call in with questions. They're going to write on the portal with questions, or they might need medication refills. So whenever I have a minute in between patients, or it might be over my lunch break, there are times when I don't get a lunch break, need to get stuff done. I respond to those messages. Our medical assistants a lot of times will filter those out and answer what they can, and they'll call back patients. I also, during that time when I'm there, I'm also looking at lab results from patients that I have previously ordered, and then commenting on those, saying whether they're normal, if there's something abnormal, what our next steps are. And then if it is something that's not, super out of range, then our medical assistants will give them a call. If it is something, I will call the patients, or I'll have a conversation with them. Also, throughout my day, I'm usually looking at EKGs, at x-rays of various parts of the body, and again, ordering blood work on different patients who are there. That would be my typical day with my one job. When I come home in the evenings, it just depends. Since it's my business, I'll usually spend some time working on some social media posts. I'm just learning how to do all of that. I'll work on writing blogs, which we've done, which we post about twice a month. And then I reach out to different pre-PA programs, physician assistant students to ask, hey, can we give you a free talk? Can we just be of help in some way? Again, our major goal is to be able to help future medical professionals to really give back to our profession. And so that's what a typical day looks like. Today, I will say sometimes, so this morning, I went into Emory. They ask for volunteers periodically, and I help their current PA students who are in their didactic year learn how to place IVs and how to do venipunctures to be able to draw blood. So sometimes I'll go into PA programs, I might teach a class, or I help them with different skills as well. So that's a very general. There's not a super typical day, other than I know I'll be at one job from this period of time. There is some times when I'm on call on the evenings or weekends, and that's so if a patient calls and feels like they're having some sort of emergency or needs to call us, they'll call and speak to our answering service. The answering service will contact me, and I'll give them a call.
So with all the patients, and since you explained your day in the life, so what's something that and someone that's aspiring to be a PA, what's something that you'd warn them about? Like, hey, like if you're gonna go into this field, then you have to mentally prepare yourself for this and this.
What I would say is, one, you need to make sure that this is what you want to do. You need to spend some time shadowing. You need to talk with people and really understand what you're getting into, because it can be very tiring. And unfortunately, in the healthcare field right now, there's a higher rate of burnout. And so if you know this is what you want to do, then the other question is, why do you want to do it? I think what a lot of people forget is they'll say, hey, I want to be a doctor. I want to be a nurse practitioner. I want to be a PA. But the question is why? And why for you? What is it about it? Because being a medical professional, my opinion, to be a good medical professional is going to take compassion. And once we lose our compassion, I think we're really doing a disservice to our patients. And burnout, unfortunately, can sometimes injure our ability to be compassionate. And so I think it's figuring out why you want to do this, being very clear, but also understanding how can you build your resiliency. And there's a lot of great articles out there on that. How can you keep yourself on task and inspired as well? And that's part of why I also, started my business, is to keep that inspiration going, to do something, do other things that keep me excited. Because it can be exhausting. Sometimes you'll have that really hard day. I've cried when I've had to tell people that they have terminal cancer and that it's spread everywhere. It's been hard. Sometimes you have people come in and they're angry and you're like, I'm not sure where this is coming from, but they're angry and they're taking it out on you. And that can be really tough. And that's a reality of working with people. People have bad days. So I think one of the most important things is being very clear of why you want to do this profession and why you want to be in the healthcare field. More than it sounds cool, but be clear on why you want to do it. Hopefully that answers that question.
So if there are high school students, what would you recommend, like classes wise, for high school or college students? Like what kind of classes should they take if they want to be a PA?
Sure. So one actually challenging thing about going to PA school, if that's what you're wanting to do, is that every program has different prerequisites. There are some similarities. You have biology, you have chemistry. Usually most of them want you to go to organic chemistry. Some want some biochem. What I would say, in the ideal world, if you know now you want to go to PA school, I would encourage you to start looking at different PA programs. If you have a sense of, I want to stay in Georgia, start familiarizing yourself with what those prerequisites are. I would also get yourself involved with a healthcare or a pre-PA program out at whatever college you go to, so you have that support system. And a lot of times there's some advisors that can help you. But you're going to have to do your classes in the sciences if you're wanting to go. And I would also encourage you, if you're thinking, because some people want to go straight from college, if that's the case, you're going to have a lot of patient care hours that you're going to need to get in. And so you need to figure out what you want to do. Very commonly, if you want to go to PA school, you're going to get some other certification. So whether that's you're going to become an EMT, you're going to be a medical assistant, you're going to be a phlebotomist, you're going to be an ultrasonographer, something. So it may be a benefit over a summer to take a certification course. And then if you have the time, is to start doing your patient care hours while you're in college, or even your summer between high school and college. If you can, I would very much encourage you to focus on being able to shadow someone. And then if you're wanting to go to PA school, they all want to see volunteer hours. Your volunteer hours do not need to be with patients. They do not need to be in healthcare. If you love working with kids, go do some volunteer hours with kids. But they want to see a well-rounded individual who really wants to be a PA, but that they give back to their communities and that they've spent time with patients. Because one thing I will say about PA school is teaching you the medicine. It's teaching you to diagnose. It's teaching you the procedures. It's not teaching you the soft skills of how to interact with patients. That your patient care hours that you're supposed to do before going to PA school, that is where you will get your flow. That's how you will understand how you want to interact with patients. You'll see other people do a great job and people do a not so great job, and you get to learn from those. So I would just say start working with patients early, start volunteering, and then really start taking your science courses in PA school.
So since we've talked a lot about being a PA and your job, so can you explain us something about your college experience as well as your PA school experience?
And explain just anything, or do you want to know anything specific about it, or just what it was like?
Like your personal experience, so what you went through, anything, like since you also talked about going to Emory, So we would love to hear about that as well.
Sure, absolutely. So I went to Tufts University for my undergraduate degree. I got a bachelor's in science there. I loved it. Go have fun in college. I again found a major where I was fascinated and I actually liked going to class and studying it. So I found it very, very interesting. I also studied Spanish, and I found learning another language is very, very helpful in the healthcare field. So if you already know one, that is going to be very helpful. If you want to learn another one, that is fantastic. I was not involved in any pre-PA societies, but I did a lot of volunteer work while I was in college. That was something that I enjoyed doing. Various ways, anything from hosting tours around the college to helping where we would have some community events with some of the surrounding areas of kids coming in. So I would say go and enjoy it. I would also say I took a semester off while I was in college because of some stuff going on. It's okay. If you want to if you need to take a semester off, if it takes you a little bit longer to get through school, that's okay. Do a study abroad. If you have interest, please go do it. If you want to get into PA school, here's the other thing. You need to have pretty good grades. It's very competitive. Ultimately, I will say, for my acceptance of my class, it was a 2.3% acceptance rate with everybody who applied. It can be very competitive. So for some people, it might be beneficial for your classes. Maybe you don't take a full load every semester so that I want to go to PA school. I know I need my grades to be A's and B's. That's okay. That's okay, especially if financially that's something that works for you. I know maybe that could be a little bit tough, but if you want to go to PA school, you need to do well in your classes. So slow down if you need to. That's just fine. I think all of us get the sense that we've got to hurry through it. Nah, don't worry about it. But I really enjoyed college. Explore, enjoy yourself, get involved in activities. Emory. I enjoyed my time at Emory. PA school is a whole different ball game. Again, they liken it to either drinking through a fire hose or sprinting a marathon. My program was almost just about 3 years, just shy of that. It was very strenuous and stressful just because of the amount of information coming. With my program, how we did it is we start off with anatomy our first semester, plus learning physical skills. So our anatomy is actually working with cadavers. And so we physically are seeing different parts of the body of people who have graciously donated themselves to the medical field. As you continue in medical, the first year of PA school, we call it a didactic year. So it is 100% in the classroom, learning diseases, learning diagnostic tools, learning procedural skills. While I was there, volunteering is something that has innately been part of me that I enjoyed. I volunteered with a group that we call Portal de la Salud. It was in Lilburn, and we would go into a church one time a month, and we would give free health screenings. We would check people's blood pressures, we would check their blood sugars, and talk to them. And people there mostly spoke Spanish. So we got to, practice our Spanish a little bit as well. There were different volunteer organizations. For instance, at Emory, we do something that's called Heal to Heal, where we do a 5K race every October. If anybody's interested in coming, it's fun. We do it over by Emory, and it's to raise money for the farm workers project that is specific to Emory. So every year through Emory, we go down to Valdosta and Bainbridge, and we give a week of free healthcare to farm workers there. So I participated in that while I was there as well. But I will say my time in PA school was 100% studying. So once I got through that first, it was about, I think it was about 13 months of the didactic in the classroom. We then moved on to clinicals. And clinicals are, we had every month we would rotate to a different either specialty or something there. I think if I remember, I can't remember if we did 11 different rotations. So those rotations would be both hospital and outpatients. So we would do internal medicine in the hospital. I did a surgical rotation, a general OR, where I did that at the VA in Atlanta, the Veteran Affairs. We do a family medicine, a pediatric rotation. I did one in endocrinology. I did a rotation in urgent care, as well as doing one that was education, where I actually came up with my own classes and learned kind of more how to teach. We do an OBGYN rotation. We do a psychiatry rotation. My psychiatry was outpatient at the VA, but sometimes it can be inpatient too. You see some very, very interesting things. I'm trying to think of what some of my other rotations were at this point. But you have core rotations, and then you have electives where you get to choose. Of course, I did a cardiology rotation at Emory St. Joseph's, which I absolutely adored and loved doing that. But again, we are generalists. So we get to do everything from surgery to working with little kids to an OBGYN. We helped deliver babies. I delivered a placenta, and then also helped in some emergency C-sections as well there. Trying to think of some other things that I ended up doing at that point. It's such a blur. But you basically, your second year is really putting everything into practice, and showing your skills. We also, while at Emory, we do something called OSCEs, where we have some standardized patients. We have people who act out. You would do that in medical school, in a nursing program, as well as PA. So you get to practice with a fake patient first, which is always very helpful. Gosh, that I would say kind of generally sums up kind of what my time at Emory was. It was very busy. Lots of studying, lots of testing, lots of working with my colleagues, and feeling like I knew nothing, even though I knew a lot.
So college sounds really fun. So did you have any challenges with it, or was it all fun? And what was your motivation for the challenges?
In my undergrad, no, absolutely, there are challenges. Challenges from having to write a 25-page paper within a couple weeks, plus you've got to the studying for your other classes. Absolutely. To even, I will say, a challenge of, you're living in a dorm and some people think they want to play music until 3 a.m. There's all sorts of challenges of, some of it can be navigating new relationships and trying to find friends and trying to find people that it was compatible with, especially freshman year. Sometimes you end up becoming friends with the people who live around you. My freshman year roommate was a transfer student who was 21 and I was 18. We were at very different places. And that was a little bit more challenging than if I had been with somebody else who was a freshman instead of a junior. I will say I had some challenges of navigating it was a different, I feel like each step has been a different way of studying. And when I started off in college, I realized, and it took me probably a first year to realize in high school, I wasn't taught some basic skills, some basic writing skills. I remember at Tufts, as I went along, they were like, in order to graduate, you have to take a writing class. And I was like, why do I need to do that? Like I've written, they're like, we make everybody do this. And at that point I was a junior and I was like, you want me to do this with Fred? Oh, okay. It was the best class I've ever taken because it finally taught me how to write. And up until that point I had struggled and nobody had sat down with me to do it. And once I had finally gotten a professor who was willing to take that time, everything forward was a million times easier. So I think it was hard to really understand where my deficits were in college because it felt like it was an extension of high school, but it wasn't. But when I was able to find those professors who really cared, and that I found that I needed to be proactive and go ask for help and put in that effort, that it wasn't just going to come easily. It got better. And that was about the time when I realized, oh, I like some of this. But if you sit back, it's all going to be really hard. I would say the biggest advice I would say is be proactive about asking for help early. And people are there because they want to help you, whether it's your classmates, whether it's the tutoring center, or whether it's your professors. Ask for help early. It's not a sign of weakness. It'll actually make it better.
Excellent. So thank you so much, Miss Anton, for your time. We had a great time learning about you and your profession. To close out our event, we would like to thank you all for joining this conversation and making it interactive.
We are going to leave the QR code for attendance for another 30 seconds. Remember, if you must complete this form by February 27th at 3 p.m. This video will be posted soon on our YouTube channel. Thank you guys and have a good night.
Thank you for having me.
Thank you.